Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope and Natural Health podcast, where I try to get you healthy the right way. Last week, we talked all about why routine exams matter. And this week, I'm going to speak a little bit of Morse code in the beginning, but all of you menstruating women that have terrible PMS, this will make sense. We're going to talk about PMS versus PMDD. So what in the heck do these mean? Well, PMDD is premenstrual dysphoric disorder. It actually is a severe, sometimes disabling version of PMS, which is premenstrual syndrome. So we'll keep those abbreviations because it's a lot of words to say. But although they might have the same physical and emotional symptoms, PMDD is very extreme and can be very disrupting to daily life and actually can be harmful or damaging to relationships around you. So I've heard of quite a few clinical cases with, severe PMDD and how, it's just really affecting a woman's life. And it doesn't have to be this way. But just note that symptoms can start with this like a few days up to 2 weeks before your period. And the symptoms actually will improve once you do start your period. So if you're having terrible PMS to this degree, this is likely PMDD, and it's an actual real diagnosis. So some symptoms of PMDD, a lot of these will interlap with PMS, but PMDD, like you'll get some really bad sleep, poor, very bad quality sleep, your mood swings with feelings of like really swinging that pendulum from extreme anxiety to sadness to hopelessness and, increased irritability. So if your emotions are legit all over the place, this is probably PMDD. You might even have some aggressive or angry feelings. This is where, relationships can play a role or be affected. And then you might even feel lack of concentration or inability to perform, usual activities of your daily life. So remember, this can happen, a couple days before your period, up to 2 weeks before your period. So that's a lot of time that you are, quote unquote, wasting feeling like this. And just know that you don't have to feel like this. This is where getting your hormones checked and getting to the root cause of why you're having these symptoms is so important. So that's a little bit about PMDD. Now, most of us do have some sort of PMS or premenstrual syndrome, but it's, again, to what degree. So PMS is milder, and the symptoms really still occur like maybe a few days to maybe a week before menstruation, like really not as lengthy as PMDD. And honestly, the symptoms can be legit anything out of the abnormality for you, which could be tension, it could be anxiety, it could be brain fog, it could be a headache, it could be maybe you're feeling a little sad, or maybe you're crying the next minute, it changes in appetite, you're having trouble falling asleep, a little bit of brain fog, your bowels are all over the place, you might have a little bit of diarrhea, maybe a little bit of constipation, you feel bloated, you're gaining weight, your libido's changed, your breasts are tender. These are all PMS symptoms. It's literally any other symptom that you could possibly imagine could be thrown in with a PMS symptom. And it's an astonishing fact that it's estimated that as many as 3 of every 4 menstruating women have experienced some form of PMS. So just note that because it's common, it doesn't mean that it's normal. And you really do not have to suffer. So this goes back to what I, pride and preach all the time about getting to the root cause. So if you know that something is off, your symptoms in your body are really messages telling you, hey, there's something going on. I want you to get to the bottom of this and fix it. And yes, there are some quick fixes out there like birth control, or, any sort of birth control, or maybe prescription medications like anti-anxiolytics or antidepressants or sleep aids to help you sleep. But again, there's a reason why these things are happening in the body. So I challenge you to really get in tune with your body, understand what's going on, track your symptoms. When women come to see me in the office, I'm asking them all about their menstrual health, and then even outside of that, the symptoms. And then I ask them, do you think this is correlated at all with your cycle? Or do you remember where you were in your cycle at this time? Because your hormones play a role. They're all over the place throughout the entire month in the cycle of repetitiveness. So if there's repeat things that are going on in your life or symptoms that are popping up, it could have something to do with your hormones outside of your menstrual cycle. So that's where we have to really dig and look a little bit deeper as to what is going on. Now, if you have no idea where to start with this, you can reach out to me. I can send you a cycle tracker or a symptom tracker for you to do this. And I also have my period productivity planner out that will have all of this information in there. So you can track your symptoms, you can track your cycle, you can work for your cycle, you can eat for your cycle, you can exercise for your cycle, all of the things. But I really wanted to pop on here and tell you that, again, like, you don't have to suffer. A lot of these symptoms are common, but it doesn't mean that it's normal. And if you are one of these women, please reach out to your primary care doctor. And if you can't get any help there, find someone like me that can help you. If you're in Arizona, I can help you. If you're not in Arizona, I can still likely help you some way. So please reach out, because again, your life is too short to feel miserable for really a lot of the year if you add up all of the weeks that you have either PMS symptoms or PMDD. So short, sweet episode talking all about periods again, which is my jam. And I thank you all for being here, and we'll be back again next week.